Hello, my name is Alison Schofield and I'm a tissue viability nurse working within the NHS. Together with Eleanor, we have produced some short videos to assist in the self-management of lower limbs and leg ulcers. This involves skin care, how to apply a dressing and how to apply different compression systems. So now we're going to look at caring for the leg. We're going to look at firstly removing the compression which is in place, removal of the dressing over the wound if you have one, and then cleansing the skin, which is one of the most important aspects of caring for your lower limb and foot. Okay, so it's good to be prepared. I've got my bowl of water with a bag inside, a plastic bag to line it to prevent any cross-contamination of bacteria into my wound. I've got a fresh clean towel, again, to stop any bacteria if you just wash them after you've used them. If you can get gloves, that's fantastic, from your healthcare professionals to use. I've got some gauze, or for washing you could use a clean like flannel and just wash on a hot wash after usage as well. That's absolutely fine. So we're going to remove our hosiery safely first. So you might need somebody to help you with this if you're struggling with arthritis in your hands, or to bend down, for example. Some people sit sort of on a bed with their leg bent and they find that easy. Lots of people find their own ways of applying and removing of hosiery. So this one is a hosiery kit, so there's 2 layers to it. So it's like having a bandage on the leg. It gives the same amount of compression, but it feels much nicer to use. There's not as much bulk, so you can get shoes on and things like that nicely. So I'm going to remove the outer layer, which comes off quite nicely because the under layer is quite slippy. Okay, so just get it over the heel, and then it comes away quite nicely on the foot. Okay, so the bottom layer is a thinner layer, like a stocking. So this is the liner, so that comes away quite nicely too. I'm going to put that over on the side, and then we can use the bowl. So we can place the foot in the bowl just to test the water. We don't want it too scalding hot, not too cold. So tepid is great. And I'm going to use a piece of gauze for washing the leg. Okay, so the dressing's still there, so if the dressing is a little bit firmly stuck down, you can wet the dressing to be removed. A tip is if you pull the edges of the dressing like so, then it will remove much easier. So just pulling the edges there, moisten that. Oh yeah, that's lovely, that's come away easily. And I can now put that into my bag, which is for disposal in the bin later. So giving the leg a nice wash and paying particular attention between the toes because fungal infections can form in there. So that's done, that's nicely done, feels nice. Give it a little bit of a massage as well for the lymphatic system, and then now we'll show you how to tackle those stubborn dry skin areas and to cleanse the wound bed itself.